ask you a question. When you hear the words security threat, what's the first thing that comes to mind? We often picture threats in the form of armies, weapons, or geopolitical tension. But today, I want to shift your perspective to a far more subtle, yet equally dangerous threat. It's not a spy, not a terrorist, and not a nation with a malicious intent. So what's this threat? It's infectious diseases. They're not just a health crisis. They are a grave security threat. In 2019, 13.7 million people worldwide died from infectious syndromes. 3 million of these people were children under the age of 5. And globally, respiratory and bloodstream infections are the deadliest. Now, this is an overview of the death rate from infectious diseases worldwide in 2019. The light-colored regions are regions with less death rate. So in this part of the world, we can see that there are about 10 to 20 people in 100,000 people. Now, if we take a look at the other part of the world, we can quickly see how disproportionately some regions were affected by infectious diseases, with death rate exceeding 500 people per 100K people. And this is not just the story. If we look at the bloodstream infections, we can see that in the sub-Saharan Africa, there are 52.6 per 100,000 people death rate, compared with only 37.7 in high-income countries. This is about 40% increase in the sub-Saharan Africa. And now, let me take you back to 2019, when COVID first hit, and soon became a global pandemic that touched every one of us, reminding us that viruses do not respect borders. COVID-19 was a stark reminder that infectious diseases are not just health challenges in specific countries. It's a societal challenge. Oh, sorry, I think, what's happening? Yes. It's societal challenges that affect every one of us. And most importantly, it reveals the fragility of our healthcare system and the importance of a robust pandemic preparedness. But COVID-19 is not an isolated incident. It's part of a broader narrative where diseases like malaria, AIDS, and many others continue to affect millions worldwide. Now, if you look closely on this map, you can see that there are some regions with the light blue color. These are the regions with the less cases of COVID. However, if we look closely on Sudan, Sudan has 18 states and 46 million population. By 2020, the government of Sudan was able to establish 7 centers of COVID-19 testing. That's 7 centers for 46 million people. Now, let's compare it to our home, the region of Waterloo. In the region of Waterloo, with the moderate-sized cities, we have about 630,000 people. We also had 7 centers. Look at this. See the difference. And in fact, it turns out there's not actually less cases of COVID, but it was the lack of testing. Because Sudan is among the countries with the highest positive rate, suggesting that there are far more cases than is actually reported. I know this because I stand before you today, not only as a researcher, but as a daughter of Sudan, a country where the mighty Blue Nile River and the White Nile River converge in the heart of Khartoum. And the heart of its people resonate with resilience, much like the relentless flow of these great rivers. My story begins in Sudan, where life beats to a different rhythm, and each day is a testament to the strength of human spirit. As I lived and worked among these vibrant communities, I witnessed both the beauty and the challenges they faced. I witnessed the death of children due to malaria, an infectious disease that most countries beat and does not exist anymore. There I saw the urgent need for solutions that can transcend boundaries and bring health and hope to those who need it the most. I wanted to be part of this solution. And this is where my journey in biosensing research began. My primary goal is simple, yet powerful: to create a rapid, reliable, affordable biosensor that could detect diseases at its earliest stages. So how does this biosensor work? You can think of a biosensor like a special detective that can find tiny clues in our bodies. It uses a special material to find these clues. And what it does, it sends out a signal saying, hey, I found what I'm looking for. And this signal can be read out in a wearable or a handheld device. Imagine the device, something as accessible as a smartphone, capable of identifying diseases before they spread further. This is not just about technology. It's about democratizing healthcare and ensuring that everyone has a fighting chance against diseases threatening their well-being. Now, as I continued my journey, I found myself at the University of Waterloo, where I delved into the world of field effect transistor biosensors, or as we call it, FET. So let me show you how this incredible little device is changing how we think about health. A field effect transistor allows current to travel from point A to point B, with point A being the start line, point B is the finish line. In technical terms, these are called the source and the drain. Now the racetrack is not your ordinary pavement. It's made up of a special material called semiconductor. And what makes the field effect transistor truly special is how it controls the flows of the electricity. It has a traffic cop that can either allow or stop racers to go through. And this is called the gate. Field effect transistors also have the remarkable ability to introduce roadblocks to the racers. In our world, we call these the bioreceptors. Bioreceptors has the ability to sense and interact with the biomarkers, the tiny building blocks of life. So this is exactly what we did with COVID-19. In our lab, we developed the world's most sensitive COVID-19 biosensor that is able to detect the disease before the onset of symptoms. And to put our work to test, I tested it on myself. Good news is that it worked. The bad news is I had COVID. And it could detect even the tiniest concentration of COVID in the human body, surpassing even the most advanced sensors available today. But this is not just about surpassing records. Remember this, we can change the narrative. Testing is the key to controlling the spread of viruses. And these tiny devices are changing the course of health work as we know it. They remind us that the power to diagnose and heal should not be reserved for the privileged few, but should be granted for all. So how can we achieve this dream? We are developing new techniques to eliminate the need for expensive, limited in access lab facilities in order to fabricate our biosensor, in an effort to make the fabrication affordable for all. Also, to make our biosensor rapid, sensitive, and selective, we are developing new smart functional materials with a novel, cost-effective, and green synthesis method to design our biosensors. So this dream is not just a scientific pursuit. It's a bridge to a future where healthcare transcends privilege, reaching every corner of the world. And as I stand before you today, I want you to know that my journey as a STEM is fueled by a deep desire for change, despite the disparities that often exist. It's not just about pioneering innovation. It's also about paving the way for others who face similar challenges and barriers. And as I stand before you today, I want to encourage women in STEM and other underrepresented individuals to join this path of discovery and join the ranks of those who are shaping our future. So today, I want you to join my journey to create a world where healthcare is accessible for everyone, and the power to diagnose and heal is granted for everyone. I want you to join me on this journey because together we can create a world where these accessible technologies are granted for everyone. We can break down barriers and rewrite the health equity narrative. Thank you.